This video will demonstrate the steps required to correctly administer a secondary medication infusion. In this example, a carrier fluid is already infusing to the patient. If your patient cannot tolerate having their primary fluid stopped or the medication to be administered is incompatible with the primary fluid, a separate carrier fluid is required. Contact your practitioner to obtain an order. To prepare the secondary medication, you will need a secondary tubing set. Close the roller clamp on the secondary tubing and spike the medication container. Locate the Y site above the pump on the primary tubing. Remove the Curos or scrub the hub per protocol. And attach the secondary tubing to the Y site. Remove the secondary container from the pole, lower it to a level below the primary container, and slowly open the roller clamp on the secondary tubing. Back prime the secondary tubing until the drip chamber on the secondary tubing is approximately 2/3 of the way full. Close the roller clamp. Hang the secondary container back on the pole, and using the hook provided with the secondary tubing set, lower the primary bag. Ensure that there is approximately 9.5 inches between the fluid level in the primary container and the bottom of the secondary container. Adjust the pole or pump height if necessary. Proceed to programming the pump. Press Channel Select on the correct module. Set the infusion rate for the primary fluid to match the rate of the secondary medication, in this case 100 mL per hour. Set the primary volume to be infused to 40 mL. Use 20 mL if the patient is fluid restricted. This will be the flush that follows the medication infusion to clear any remaining medication from the tubing. Now press the secondary soft key. Select the correct drug from the library options and set the drug amount. Press Next. Confirm the duration or enter a duration if necessary. Open your secondary roller clamp and then press Start on the pump. Before leaving the bedside, visually verify dripping in the secondary drip chamber and no dripping in the primary drip chamber.